Now to health matters. Diseases pose a huge risk to national population. For this reason, doctors embark on a series of public enlightenment to ensure the safety of lives. In our next report, senior correspondent Jacqueline Oga unfolds what doctors have to say about the risk factors associated with obesity. We have details in this report.
Doctors say more and more people are reporting in the hospital, especially women, and they are being discovered to be obese. This health condition occurs when a person's body mass index is beyond 25. If medical advice is not sought quickly, the increase in fat and weight of such a person could lead to the medical recommendation of bariatric care, which is the specialized treatment of very severe obesity. It includes surgical intervention for weight loss, like the gastric bypass and the input of a balloon into the stomach of a patient. At this conference of bariatric surgeons, I got Dr. Arinze Chukwumosanya on the sidelines for more details.
In bariatric surgery, what we do is to help the body to manage itself better. And this helping of the body includes either through surgery or placing of what we call balloon inside the stomach. So I'll start with the balloon. So when you put a balloon inside the stomach, it reduces the space available for food to stay. Therefore, the person eats less. Also, the presence of that balloon can also help the body manage certain hormones that control things like hunger and fullness. The second part of bariatric surgery then involves the actual surgery we do. And in those actual surgeries, what we actually do is to reduce the size of the stomach by taking away about 80% of the size of the stomach, or rearrange the small intestine in such a way that you handle food easier and better, you absorb less of whatever you eat, and therefore you don't add much fat in the body.
The doctors here say, among other diseases, obesity causes hypertension, stroke, kidney and fatty liver diseases, some types of cancers, mental illness arising from emotional trauma, and problems associated with breathing. For these reasons, surgery is advised for safety.
Bariatric surgery is very, very safe procedure actually, especially the laparoscopic sleeve gastrectomy, where we take away about 80% of the portion of the stomach. But generally, the mortality for bariatric surgery is actually less than 0.3%. globally. So it's a very, very safe procedure, easily done, and that's why patients usually prefer bariatric surgery.
Bariatric surgery right now is considered as one of the important interventions that you can do for a woman who is obese and cannot conceive to increase her chances of conception. Simply shedding those excess weight helps, rearrange and modify the hormonal imbalance they have.
This year has to be different.
This medical expert is disturbed that women show up more to check their body mass index more than men do. He says men must understand that as heads of families, obesity causes dangerous health conditions that could lead to early death.
You can get problems that can affect different organs like diabetes, sleep apnea. You could get arthritis. You could have issues with your immunity. You can have depression, anxiety, polycystic ovary disease and infertility. So there are a lot of issues.
Nutritionists also say if surgery is recommended for the treatment of severe obesity, they offer advice that promotes safety before and after surgery.
So we do a thorough nutrition assessment, consultation. We look at the foods that they're currently eating. What could have gotten them to this stage in their journey? And after looking at those foods, then we make a customized meal plan for them. So whether they're from any parts in Nigeria, any ethnic group, we customize their food.
Doctors say because obesity precipitates deadly consequences, Nigerians should no longer handle the checking of their body mass index nonchalantly. Jacqueline Ogo, TVC News.